After dental school, there's life. There's life as continuing education, but there's also life as in working, right? Deciding to go into private practice. But some people, or even sometimes many people, will make the decision to do a residency. So, with that, which program should you go to? What are the things that you're looking for in the program? What things should you be looking for in the program? All that and more we're going to be talking about uh, as we spotlight one of hundreds of programs that are in New York's, and more specifically in New York City, right? Very popular destination for many, not only to get a license in New York, but also to train, etc. So today we're going to be talking with an associate program director all about their program in New York. For those of you that are considering doing a residency program, not only considering residency program, but also in the city, in the state of New York. So this episode, we're going to be talking with the program director, and we're going to be asking questions, going to learn a little bit more about the overview about the program, the mission, the curriculum, how the program is structured, caseload, the number of residents, what the program is known for, strengths, and also areas that are being improved over the years. But also, what is an ideal candidate for a GPR residency program, and some tips and advice. So make sure that you're staying all the way through, okay? Also, this episode is being brought to you by GetIntoDentalResidencyChallenge.com. GetIntoDentalResidencyChallenge.com, the ultimate resource to help you jumpstart your residency application process so that you get the attention of program directors so you can get to the next step, which is get to the interview, and then from the interview get into the program of your dreams. For more information, go down to the link down below. So special guest from New York, my old stopping grounds. We're going to be talking today's residency program will be Long Island Jewish Medical Center, and we're joined today with one of the directors of the program, Dr. Milford. So how you doing, Doc?
Good, thank you. My name is Dr.
Millord,
Milford.
Millord,
Just a
Millord.
small correction, and I'm
Yes,
doing well. Thank you so much for having me on your program, Dr. Hayes. It's good to be
thank
here.
you, thank you. So, please introduce yourself. Tell us a little bit more about yourself, and for those individuals that are meeting you for the first time, give us a little bit more about your background before we jump into the questions.
So my name is Fabiola Milord, and I am a general practice. I'm in general practice. I have my office is so I do two part-time jobs. My office is in New Hyde Park on Long Island, and I'm the associate program director for general practice residency here at Long Island Jewish Medical Center. I graduated undergraduate from St. John's University, which is killing it on the basketball scene right now. And I'm very proud of that. And I then for dental school, I went to New York University College of Dentistry. And then after many, many years out of seeing some healthcare disparities, especially in oral health, I decided to go back to school. And I did a master's degree in public health again at New York University. So that's a little, I grew up in New York, never left. I have traveled all around the world in the name of healthcare and oral health, and to see some of the best in healthcare, and so including here in the US, and some of places that can be significantly improved upon. Um, I think that with the general practice residency, had I not done that, I don't think I would be as useful as I could be in some circumstances. So I'm very grateful that I took that route.
Yeah, and for many, that's one of many reasons for us as dentists to go back into academia and to help to mentor and guide the next generation of dentists, right? Especially those that are looking to get some advanced training. So, um,
Oh,
also a lot
one
of
more
things.
thing, let me just
Uh-huh.
mention that I did my general practice residency at Metropolitan Hospital in Manhattan. And then afterwards, I was invited to do a 1-year dental oncology fellowship at Sloan Kettering Cancer Center. So that's my educational background.
Sounds good. Sounds good. So, with that background, one of the roles that you have done over the years and that you're currently doing, even as a private practitioner, is um, being an associate program director. So, talk a little bit about that role and how that became part of um, your contributions to oral health, so to speak.
So I was working at New York University. I was teaching at NYU College of Dentistry. Um, and I was there for 8 years. I love teaching it, and to see young people become sponges of information. And in dentistry, to see somebody repeat a procedure the way you taught them how to do it, and you could almost see yourself in how they do it, it's very rewarding. Um, so that's how I started in teaching. And I was contacted by the assistant vice president of the dental medicine department here at Long Island Jewish to see if I was interested in joining the GPR program here as associate GPR director. Not being a program director because I have the office. So the program director is a full-time position. And since I have the office, it's a part-time position. And that's how I managed to get here to LIJ. The
Gotcha.
teaching here is, I can't tell you how even more rewarding it is, because it is young people who have a knowledge base, but they realize that that knowledge base is just that, a base. And they know that there's much more that they can learn and that there's much more that they can do. So they chose the general practice residency route. They want advanced cases, they want advanced training, they want to see more, they want another level of difficulty. Why? Because when they get out in private practice, there will be, there's not much that they'll be far less intimidated by things that come their way. So,
Yeah.
and then to improve the speed, to improve
Yes.
the
Yes.
complexity of case management of a patient who may be very sick, they won't be as intimidated. And that's why a lot of the, now, to tell you the truth, Dr. Hayes, some people just want to come home. If they've been to Boston, if they've been to Chicago, if they've been to Texas, if they've been to California, and their family is from New York, they'll just say, look, I've been out for 8 years. I've been out for 10 years. It's time for me to come home. My parents expect me home. Um, Grandma wants me home. So they'll choose to come to a residency program where they grew up so that they can be, it's lonely out there. They just want to come back home and be close to their family.
Yeah, and that's a great reason, and one of the things that a lot of candidates are looking for, right? As far as location, close to maybe going back home for various reasons, family, maybe family business, maybe they had a mentor that is welcoming them back home to their practice as well. But you also noted a couple of great things about why why new dentists will decide to do a residency program, right? And that's key because unfortunately, dental school, there's just not enough time to do everything in dental school, right? And over the years, since Dr. Millord and I have graduated, even those experiences have changed for new graduates. All right, so that's one reason. But also, like you mentioned, case complexity and the level of competency, but also the level of comfortability in doing certain cases, the level of confidence, but also the level of being able to elevate your communication with dealing with patients, not one or two patients a day or two patients a day, but maybe in excess to uh, 10 to 15 to 20 patients a day. So I'm glad you brought that up, and want to hear a little bit more about Long Island Jewish Medical Center as a program. So let's pivot now and talk a little bit more about. Hey everyone, it's Dr. Darwin. Just want to take a quick break from this episode and hope that you are enjoying it. First thing I want to ask is, did you know that a large majority of the individuals like you who watch these episodes are not subscribed to the channel, to the YouTube channel? Nevertheless, we want to say thank you for watching and continuing to share these videos and episodes with others. Next, I want to say is subscribe. Yes, please hit the subscribe button so that you get these notifications each time these episodes are released. Last is I wanted to connect with those of you who are seeking to become an advanced dentist and specialist. And I invite you to our next event called the Get Into Dental Residency Challenge. This is a special 4-day event that will give you direct access to the mistakes that you want to avoid when you're applying to residency programs, and also the 8 steps that you also want to avoid so that you do not have an unsuccessful application submission. The information that we will be covering over those 4 days will be some of the tips and strategies that I teach in my one-on-one and group coaching trainings with clients who are continually and successfully being matched into and selected into high-profile residency programs here in North America. So if you're pursuing or aspiring to get into dental residency this application cycle, this challenge is for you. Check out the link below to receive more details and join the challenge. And also, I would encourage you to enroll in the challenge via the VIP experience. The VIP experience gives you actually access to a 1-hour Q&A session every day of the challenge before we actually get started with the challenge. And it guarantees me to answer your specific questions that you and other VIP experience members have on a daily basis. So I'll see you in the Get Into Dental Residency Challenge, and let's get back to this episode. Program, starting off with the mission and the purpose, because every program will have its own mission related to the hospital. Maybe it's part of the hospital's mission, but also in the dental department or the oral health area, there may be a specific purpose as to why that program or why your program is in existence. So, what's the mission there at Long Island Jewish Medical?
Simple. Oral health care for all. Accessibility. I don't want people to think that this is an easy program, because it is not. You have patients here who need dental services, and I'm glad to work in an organization that recognizes, because not all hospitals have dental available. So we here at Long Island Jewish Medical Center realize the importance of dentistry and oral health. You have patients who are special needs, who are in wheelchairs, who are nonverbal, who can only be seen in an operating room setting. It very limited in an outpatient dental clinic setting. You have very elderly, very frail people. You have cancer patients who you have to be very careful with their medications. You have patients who are very sick. You have patients who have suffered severe trauma. So you also have your routine patients for your dentures, crowns, implants, bridges. You have all of that too. And they just hired somebody for aesthetics who was doing, facelifts and all of that with oral surgery. The other part here is that we offer multiple specialties, and it is some of the best: oral pathology, pediatrics, oral surgery, and general dentistry. About to start orthodontics. All available here at Long Island Jewish Medical Center. Again, the mission is oral health for all. Sometimes LIJ is the last stop. They could not handle, whoever the private practitioner is, couldn't handle a particular case in a private practice setting. And the private practitioner will say, you know what, you need to go to the hospital. We can't take care of you here. Why? Is it a particular medication that they're on? Is it a heart condition? Is it a kidney condition? Is it whatever their medical status is? Oral health is related to general health. They cannot handle it on the outside. So they decide to bring it to the dental clinic here at the hospital, where we have certain safeguards built in so that if something really goes wrong, hopefully it won't be something that we won't have something in place to manage whatever went wrong. So that's part of our mission. It's oral health for all, whoever you are, whether you're verbal, nonverbal, in a wheelchair, elderly, strong, you got hit in the face, you were in a fight, whatever it is, you need us. And as dentists, I really hope young people realize how privileged they are to be in this profession, because no matter what, you can do what nobody else can do. The cardiologist can't do it. The neurologist can't do it. And they need clearance from the dentist in order to do what they have to do. So you got to go through dental first before
That's
you
right.
can get your stuff
That's
done.
right. Y'all heard that. You go through dental. Everyone goes through dental, just like food goes through one spot before it hits your belly. It goes through the mouth, right? So, yes, another reason why oral health matters, because it's part of overall health. And in the hospital setting, there are instances where individuals who need to go have surgery will need what? A clearance. What type of clearance? An oral health clearance. Which leads me to other parts about the program as far as the curriculum. How is the curriculum structured at your program?
So we've had to update our curriculum. Lectures, we have grand rounds once a month. We have short rounds. Grand rounds are the residents present a topic, a relevant topic within dentistry, and it could be anything from aesthetics, composites, mental health, anxiety. It could be whichever topic of the residents choosing. Two residents will present a particular topic once a month, so that everybody is familiar and can definitely dissect through that particular topic. They have journal reviews, all those journals that we get in our homes, and I know Dr. Hayes knows about journals and lots of journals that probably come through, whether it's from the ADA, the state journals, the triple O's, or whichever it is. You gotta understand what that research is. It valid research? Does it apply to anything you're doing? We will take one journal article and we will dissect that through. Lectures, we have a fantastic faculty who will present on whatever the topic is. Is it going to be pediatrics? Is it going to be an oral surgery topic? Is it going to be, an oral pathology topic? There was one topic, oral pathology. It escapes my mind what they presented on, and I was blown away. And I've been in the profession 31 years. I'd never heard all this before. So you're never too old to learn. So that's how the curriculum, there's always some lecture, there's always some topic, there's always the latest in a journal article that even in dental education article that we have to go through in order to keep current about what's happening in the profession.
Absolutely, and it's also a code of requirement. It's a standard in the Commission on Dental Accreditation for residency programs, just like it also applies to dental school. But for residency programs, you're absolutely right. Programs and residents must have experience and documented experience on being able to evaluate scientific literature and present it as well. You mentioned lectures and you mentioned journal review. What's the routine on a weekly basis? How many lectures do residents have on a weekly or monthly basis, and how many times will they be doing the journal review as well?
The journal reviews are once a month. The grand rounds are once a month, but the lectures are 2, sometimes 3 times a week. They can be they're early or they're late, 7:30 in the morning, because can't interfere with clinic hours. So it's either going to be 7:30 in the morning or it's going to be 5 p.m. 5 p.m. is tough because by then the resident is like, oh, we're done. But 7:30 is a little easier for them. And we find that they're a little bit more alert at 7:30 in the morning. But typically it's 2 or 3 times a week. And the faculty member will set up a room. And the good thing is, it's not only the residents who attend. A lot of faculty will choose to attend as well. And then once every 3 months, they'll have what they call like a grand lecture, and you'll get somebody from outside the organization to come in the evening, and they'll have dinner and everything, and they will present on a big topic. It could be a topic such as a big cancer surgery that took place, or it could be anything within the profession that the resident will find relevant, and also the faculty will find relevant. Like, even I didn't know that. So this was a good topic. But typically the lectures are 2, maybe 3 times a week.
And then as far as clinic hours, I know you mentioned that, they have lecture usually in the morning before, I would think clinic, and then possibly at the end of the day. So what are typically the clinic hours that residents will be providing care?
Clinic hours are standard 8:30 to 4:30. But I have to be very clear about this program. 8:30 to 4:30, with lunch from 12 to 1. However, if you run over during lunchtime, it's not just drop the patient and go to lunch. Can't do that. Got to finish what you're doing. I will certainly help you, and the faculty will help you so that you get a meal. Nobody needs an exhausted resident. That's not useful. But sometimes things happen, the unexpected happens. That's the one thing I can guarantee about residency. And that's the strength of how to deal with that unexpectedness. So even though it's 8:30 to 4:30, if you find yourself at 4:45, 5 o'clock, oh my God, I'm not finished yet. Certainly I will stay until you are finished.
Right.
Any faculty member will stay until you are finished. And we will jump in to help you finish, so that, whatever commitment you may have at home or whatever other things you have going on, you can get some rest. Now, I'm surprised you didn't ask me about the on-call that days, but
That's my next question. I was getting ready.
okay.
Because you mentioned, 7:30 to 5, but
4:30, 4:30,
4:30,
7:30,
4:30.
4:30.
Right. And
8:30, well, 7:30 is the lectures, but the
right.
clinic hours are 8:30 to 4:30.
Yeah, so there's any given time a resident's actual time at the hospital will be as early as 7:30 for lecture, and then possibly 4:30 or even 5 o'clock if you run over for after clinic. But like you said, a couple other things come into the mix, right? There are times where you have guest speakers. You may have those presentations and a dinner in the evening, but you also may have call. So tell us about how call is structured at the program.
I'll tell you about call. I really want to be transparent. And I know that if my residency program is like this, I'm sure other residency programs are like this. So call, there was a good change that happened with call. So call used to be, every once every 2 weeks and then you would have to come to clinic. That's done. The good change that happened is now it's night call. So you are on call at night for uh 2 days or 3 days, but you don't come to clinic the next day. It's like working an evening shift. You're just working in the evening and you don't come to clinic during the day. So the residents were very appreciative of that. No more every third night, no more, none of that. You stay at night, you don't come and you rest during the whole day. So that's a good thing that's happened. Another thing about the hours is I mentioned about 7:30 lectures or 8:30 clinic, but sometimes you have to be here at 6 o'clock in the morning. Why? You have an operating room case of a special needs patient. We could not manage the patient in the clinic, and the patient has to go to the operating room. Dr. Milord does not dictate the reservation of the operating room. If the case is scheduled for 7 a.m. for this patient to be seen at 7 or 8 o'clock in the morning in the operating room, we are obligated to be here at 6. Consents have to be done, pre-surgical testing. Does the patient have any questions? Are there any last minute details that need to be ironed out? Do we have the proper equipment? Is everything working? Is the laptop working? Can we take the x-rays? We are obligated to be here at 6 in the morning, which is tough. But again, we're blessed to have a profession where we are in a position where we can help that patient get the dental care they need in the operating room. So the hours are, yes, officially 8:30 to 4:30, but there are a lot of caveats with that and a lot of extra stuff that come with that. But the good thing is the call. The call
Yeah, the
has moved
call.
to all night, so you don't have to work during the day anymore. That's no longer on the table.
So for example, Dr. Smith is on call tonight, right?
Mhm.
And she will be on call for tonight, tomorrow night, and Thursday night, so to speak, 2 or 3 nights, right?
Mhm.
However, when daytime comes, she does not have to come to the dental clinic, correct?
No more. That's when you and I were doing residency.
Yeah,
Those were the bad old days when you and I were doing residency.
please.
That's
Up all night. Up all night.
right. And then you were expected to perform during the
Right.
day. That's done. Thankfully, they that at 2 weeks at a time, I think if they 2, 3 weeks for uh 2, 3 nights or 2, 3 weeks, they don't have to do the daytime anymore. They could
Right.
go home and get some rest.
And I know that has been a contentious point for many residencies in New York, primarily with the resident unions representing residents and interns and making sure that there's some parity in dental like there is in medical. Because just a quick aside, a lot of the on the medical side, if you're on call, depending on which specialty you're in, but for typically in New York, sometimes if you're on call on the medicine side, no, you get to rest the next day. Like that's your rest day. And it also goes towards the number of hours that you can, total number of hours that you can work during the week. So glad to hear that change. And I'm sure people who are listening and watching are glad to get that clarification about call because that can be a point of contention for candidates who are considering residency programs, especially hospital-based residency programs as well. You mentioned we talked about quote unquote Dr. Smith, and she's one of the residents, or hypothetically. Uh, I want to learn a little bit more about the number of residents and mostly where are those residents coming from which dental school. So how many residents are in your program?
Residents are, it's 14 residents, and they cover two hospitals. Uh, One is North Shore University Hospital, and one is Long Island Jewish Medical Center. And they rotate through the two hospitals. Um, where are they coming from? They're coming predominantly from the New York area. And I'll say Columbia, top applicants are UConn, Columbia, NYU, Stony Brook, Truro, some from Howard. This is if you get an East Coast vibe, you're right. Some from Howard, and there's one school that I'm missing. Pittsburgh, Penn. Um, those are typically the schools that are applying to, not Pittsburgh, Penn. Those are typically the schools that we are getting mostly from the Northeast part of the country.
Now, when you mention they rotate in those two hospitals and they're split up 7 and 7, describe a little bit more about how they rotate. Are they rotating a month at a time? Everyone rotates? Are they rotating
Everyone
on
rotates
quarterly?
every 7 weeks. So and you get to, that's how you get to work with many faculty who impart many experiences. And when I think about it, some of the rotations are, it's 3 hospitals when I think about it. So you've got Long Island Jewish and North Shore. North Shore is the mothership. That's where most of the residents are housed. And they rotate through Long Island Jewish, where they provide comprehensive care services, emergency dental services. If they're called to the emergency room for whatever reason, they have to respond to that particular emergency. At North Shore, it's mostly comprehensive care services. And Parker Jewish Medical Center, where they take care of the very, very elderly and frail population. Parker is a hospital for the elderly, and they rotate 2 weeks at Parker, 7 weeks, 6 weeks at Long Island Jewish, and 7 weeks at North Shore. So they are always on the move, delivering the dental care that the patients deserve and expect.
And the residents that usually are at Parker, is it the same number or is it less? I know you said you
No,
have
it's
14.
two. It's two
Two.
residents from
So two
Parker.
residents, 2 weeks. North Shore probably has 7, and the other one, LIJ, has 5. So residents will be rotating
Correct.
over a period of time
Correct.
at those 3 locations. Gotcha.
Correct. Correct.
Gotcha. You mentioned comprehensive care, which is a great segue to learn a little bit more about the patient caseload. So, what type of experiences are residents receiving during the residency, and based on the type of services that they're providing as well?
So caseload. Um, if you're doing, there are 2 residents at Long Island Jewish who are assigned to emergencies and emergencies only. Why 2 residents? Because there's always an emergency happening. Especially after a holiday or whichever, there's always an emergency. So you need 2 residents covering those. And that's where your advanced skill sets come in. Extractions, suturing, incision and drainage, um, working with oral surgery. So that's one part of it. The other part is delivering regular dental services. Um, I need crowns. My daughter's getting married. I need crowns. I need dentures. I need teeth in my mouth. I need a bridge. I need implants. A lot of residents now, they want to not only be able to restore implants, they want to be able to place them. And
Yeah,
that's
that's
one of the
key.
things
Yeah,
that
that's a
it is
key.
key.
That's a key.
Oh yes,
How many implants would you say on average each resident is placing during the 1 year? And
throughout the year, I'd say each resident, uh, it, they get the chance to place maybe 2 or 3 implants. I wish I could say more, but there are things with insurances and payments and everything else that also the finances have to be accounted for, plus in distribution of cases. So everybody has to have a fair shot.
right.
So I wish I could say, oh, they placed 10 implants during, no. Plus, remember, we have an oral surgery program too. So the oral surgeons also want the bulk of placing implants. So I tell the residents, look, you're a GPR resident. If you find that implant, it's yours. You can place it. If you are
So
able to speak to a patient about restoring an implant, replacing a tooth, and you did it, you get to place the implant, or oral surgery helps them place the implant, guides them, and I'll help them out with the restoration.
so residents have opportunities and experiences to both treatment plan and coordinate with either the surgeon, whether it be oral surgery, some cases is the
And the
GP
periodontal
and the
or the
periodontist.
periodontist
Yep. And then
to
they also have experiences where they are restoring those implants too, correct?
absolutely,
Good.
absolutely. Well, or even up to our chief resident, who's our second year resident. That's the good thing about the second, and that's the attraction of that second year, is these all on X cases that they get to um place the implants. Still, under the auspices, oral surgery will help them out. And restoring those cases, that is something that they really, really look forward to.
So how many second years are at the program?
At LIJ, starting in July, will be 2 second years. And then there's 2 second years at North Shore. And then there's an extra the 2 second years at North Shore transition to 2 implant fellows at North Shore. And that's a part-time position for a third year.
So you guys are listening. I hope you guys are taking notes. If not, pause, go back, because there's a second year program and a third year program, and both of the second and third year are geared towards getting you some more experiences in what? Implants. Yes, implants. Implants. So so there is a PGY 3 year that focuses on part-time being able to give you some more experiences.
It's
Place
part-time, but it is something that is extremely competitive and
now when you
only
say
open,
part-time, what do you mean part-time?
I think it's 3 days a week,
3 days a
not five
week,
days.
meaning their schedule part-time,
We
3 days a week is placing or deal or
only
working with.
implants. That
Okay,
fellowship is
got you.
only implants, nothing else.
Right, got you. And I know there are some other programs in the New York area that have something similar as for second years, maybe even third years, where those PGY2 residents are focused mainly either on doing endo cases and others areas that may be of interest not only to the residency program but also to that resident that decides to stay on for a second or third year as well. So there are some second year programs. I mean, I'm sorry, second year residents. Looks like there's about at least four, two at LIJ and two at North Shore, and then potentially if interested, there's a PGY 3 year, and some of
Only at
those
North Shore that
only at
will
North Shore.
transition to fellowship, to the
Right.
implant fellowship.
And how many of those for PGY 3
Two,
part-time? Two?
two, two. The
Okay.
two that are chief, the assumption is they will be elevated to implant fellows. They're automatically elevated to implant fellows.
So I'm just doing my numbers here. Make sure I'm tracking here because
Mhm.
again, you all may not may not get these details if you go on any website for any residency program. Second year positions, two
Mhm.
LIJ,
Yep.
two North Shore,
Yes.
and then the thought is the two at North Shore may go on to be implant fellow, which means two more, but they are two that are third years now,
Yes. Part-time.
part-time. So that's six positions outside of the PGY 1 year. So
Yep.
14 plus six is 20 or something
No,
like that.
something's
No?
wrong. So
Uh-oh.
no. So it's two PGY, two PGY 2 and two PGY 3.
Okay.
So two PGY 2s at North Shore. The LIJ is just, oh yeah, you're right. You're right. I think your numbers are right.
Two
It's
at LIJ.
two at LIJ, two PGY 2s at LIJ, two PGY 2s at North Shore. And then there are two PGY 2 PGY 3 part-timers at North Shore as well. You're right.
So, and I just wanted to go over
Your
those
numbers are
numbers.
correct.
I just wanted to go over those numbers because there could be people, oh, there probably are people that did not know that there's some additional implant training, hospital-based program that you are able to focus as a second year and more, even more exclusively as a third year PGY 3 year at your program, which may be of great interest to many that are listening and watching. So, again, hope you guys wrote that down. If not, pause, go back, take that note, and start right there. Um, we talked about mission, we talked about the curriculum, patient caseload, um, also, and we talked a little bit about the number of residents. As it relates to caseload, I just want to go back to that real quick. What are some of the other experiences related to comprehensive care? Are they getting some experiences related to digital dentistry? And how
Root
does that fit
canals,
into?
root canal, apicoectomies, retreatments of root canals. Root canals, I find that it's a challenge. So that's why I keep saying root canals. So root canals, and because a lot of people come in needing a root canal. So root canals, um, digital dentistry, as in scanning for your implants, your crowns. I always ask the resident, what do you prefer? You prefer to take a digital impression or you prefer to take an analog impression? And it depends on what school they went to and how they feel comfortable. Some schools, especially Toro, they are very comfortable with their digital impressions. They love digital impressions. And some people that say, your NYU Columbia people, they'll take the digital impressions as well. But I find that they are a lot more comfortable taking the analog impressions. So impressions for your partials. We really don't really make a lot of complete dentures as much as we used to, unless a patient really needs it. And even if they do make a complete denture, there's always some implant involved there. Um, uh, the regular restorations as far as operative dentistry, that's still a mainstay. Hygiene, cleaning, scaling, root planing, periodontal surgery. We have a lot of residents who have gotten a lot of experience in periodontal surgery. So
What kind of
again,
surgeries are they doing for perio? Are they doing crown lengthening or
crown lengthening as well as osteosurgery for maintenance of the periodontium. full thickness flap, reshape the bone, suture back so that the patient has an easier time maintaining the periodontium. So all of it is truly what I mean about comprehensive care, whether it's in the clinic or what also if it's in the operating.
Right, right. As far as the digital dentistry that residents have exposure to in cases that they're working on, what's the combination of different actual products or manufacturers? Are you using Ivoclar? Are you using I forget the name of the I just heard Dandy digital
No, it's
scanning.
mostly Ivoclar. Dandy
The
the
lab,
lab.
that's
I
right.
think they give you the computer and everything, and then they do the lab work. And that's good because they're trying to make it easier for dentists to have accessibility to all this expensive equipment. So I
Yeah.
give them a lot of credit. And I don't
Itero,
work for Dandy, by the way.
are they
Um,
using Itero as well?
iTero is not Plan Mecca.
Plan Mecca.
Plan Mecca is the software that Blue Sky for the implants. Plan Mecca is primarily what they use for the software. So that not really iTero. So those are the two that they really use here.
Overall, what would you say? And now that we've got some more insight into the program uh, overall, but we have more insight as the program as an overview. What would you say are some of the key strengths about the program?
The diversity of procedures, the diversity of patients, the diversity of faculty. The more diversity you have, you get different aspects and different points of view. And it becomes a strength because you are not a one-trick pony. You know different ways of approaching a problem, different ways of doing things, different ways on managing a patient. You have two general practice faculty who look at the same thing and come to the same conclusion, but have different ways of managing a patient. So to me, the the strength of the program is that the difference in opinions and people and the variety of thoughts and procedures, the more you have in your toolbox, the more you know how to manage a problem. That is the strength of this program, the diversity of everything and everybody that comes through. That is the strength of this program.
Now, when you say diversity in the faculty, how many faculty members? A
Oh
combination
boy.
of
Ooh.
volunteer, part-time, full-time, including
Um,
yourself. How many faculty members are in the or
here at
associated with the program?
here at LIJ, um, I think that the program director is full-time, the division chief is full-time, the chair is full-time, I'm part-time. I don't have exact numbers to tell you the truth, and shame on me for not knowing that off the top of my head. There are, but it again, there are part-time faculty, there are not too many full-time faculty, there are volunteer faculty. And to me, I have the utmost respect for the volunteer faculty who come and do what they do because they truly enjoy teaching young people. And most of the volunteer faculty have graduated the program themselves, so they've come back to give back to the program what they've gotten out of the program.
As far as areas of ongoing improvement or areas where the program has started and is currently making some improvements, What would those areas be?
Areas I think that we can improve upon. That's a really good question.
Or
Um,
even areas that recently, over the last several years, you've made some improvements. I know you mentioned the whole notion about call,
that was the number one
and I
improvement.
know that was the number one, right? I know that one. That was
That
definitely the
was
number
for the
one. I know.
residents. That was a godsend. I wish I'd had that. I was on call every third night in my residency, so it was rough for me. But the number one, and that was a recent improvement last year. The number one improvement was the call schedule, and that they just take the night call, and that's it. But there are other areas that the facility we may want to, upgrade some of the facility and everything else. And I think that's in the works as well, that they may be moving to a more modern facility. But beyond that, I think that the program is doing what it's supposed to do, which is educating new dentists in the areas that they need to deliver the dental services. I think the program is great.
Great. So for candidates who may want to wonder how they're going to fit into the program and be part of this, um, the greatness that you shared related to the strength of the program and how the program is structured. This question is for them as far as what the program is looking for. What are some of the things that the program is looking for and characteristics that make up LIJ's ideal candidate?
The number one thing I think is, be yourself. Besides grades, yeah, but everybody's looking for grades. That's why we have transcripts, and that's why these programs are so competitive. But besides grades, you have an opportunity to make an impression during the interview. Bring your A game as far as your personality goes, as far as answering questions. Some of the questions, it's like, I think the questions tend to be more conversational than trying to pick your brain as to how to do a proper MO slot prep on tooth number two. It's really about looking good, being professional, putting your best face and your best thoughts forward, being thoughtful and mindful when answering a question, not even slightly uh, being there was one interview I'm thinking of whereby the interview could have gone better because you don't know who your interviewers are, and some of the answers can tend to be a little bit condescending. So be mindful of what you're saying during an interview and how your answer can be interpreted. Because again, you don't know who your interviewers are, where they've been, what their life experiences have been. So be thoughtful, be mindful, be yourself. Don't fake it. If you don't know, say, you know what, I didn't think about that. I don't know.
So you're hitting on some great points related to some tips and advice when they interview, right? But also in the interview and also prior to the interview, the program is looking for certain things, certain ideal characteristics for the program specifically. What are some of the things that the program is looking for in candidates that they eventually would want to match at their program at LIJ? What's LIJ looking for in those candidates? What's going to make them a good fit at their program overall, not just on interview day, because we know the evaluation starts way before interview day, and interview day is not even enough time to really get a full synopsis and assessment of the individual. But when you're going through the applications, when you're reading the CV, when you're looking at the personal statements, what are some of the things that you all are looking for based on how the program is structured, what the mission of the program is, and how LIJ, North Shore, and Parker all combined deliver its mission of making sure that there's oral health access for all?
You know, that's an excellent question, Doc. And I'll say this. Those letters of recommendation, they're key for me. I can't speak of the other people. I can't speak to what the others are looking for. The personal statement speaks from your heart to whoever you are writing. You're writing about your mission and why you want to do a GPR and why you think you'll be a good fit for our facility and our hospital. That's good. But those letters of recommendation, if I could give one piece of advice as far as how that candidate will fit into our program, please, I even tell this to my nephews, one of them who's about to apply to college. Be very careful who you ask your letter of recommendation from. Because those LORs are, I think you check a box that says that you have the right not to review it or something. You know what I'm talking about, Dr. Hayes. Be very mindful of who, because I've seen some LORs that are just, wait, why did you ask this person for a letter of recommendation? And that automatically eliminates you in the running. And I know that if that person knew what this particular instructor, colleague, former boss wrote about them, they would not ask that letter of recommendation. Also, why did you ask? Who exactly are you asking? Usually it's a dentist that you've shadowed, an instructor, the clinic director. So why are you asking a dental assistant? Why are you asking your uncle? And you say that's my uncle who's not a dentist. Why are you asking? Okay, so be very, yeah, Dr. Hayes, some of these applications, I'm just, something's going on here. So be careful who you ask. Because for me, letters of recommendation, the personal statement is huge too. Some of them, they go through tremendous challenges. And you're like, you know what, after a challenge like this, no, you deserve an interview.
What in that personal statement makes it potentially makes the candidate a good fit for your residency program?
The it's the overall tone of the personal statement, meaning that a lot of them have, and it comes from, or again, remember what I said about diversity. Diversity comes from well-to-do backgrounds to backgrounds that have had certain challenges. So even if you're from a well-to-do background and you've done well in life and you are humble enough to realize that you want to pass on all that goodness that has come your way to others and be able to do good for others. That's great. That's somebody that you realize that you've had it good and you want to pass that on. I want you as a candidate. Challenges. I've had a difficult pregnancy during residency, or I was very sick, or I lost a parent, or I come from a background where, I didn't have a lot of resources, and yet, well, still I made it to this point. I'm amazed. Again, there's something in that personal statement that really touches you, that you say, you know what, I need to interview this person. There's more here, and I want to dig deeper. But again, the personal statements can speak, but if you don't have these letters of recommendation that just say, if I were you, I wouldn't take them, which has happened more
Yeah.
times than I
Oh
can
yeah.
even, like, why did you ask this?
Yeah,
If
that's
I were
key.
you, I wouldn't
Right.
take them.
Yeah,
Or
that's key.
they need, thank God they're going into your program, because they seriously need help.
That's key. Yeah, that's a great segue because you've been sharing some tips and some advice just with as relates to candidates and how they present themselves, right? So, based on that, tips, advice, a couple more things that candidates need to know or what they must do related to preparing their applications and preparing their getting prepared for the interview and making sure that they represent themselves. You mentioned a couple of them previously as far as making sure that you're being yourself, being professional, being mindful, especially as it relates to who is writing your letters of recommendation. You want to make sure that you are being represented in a very strong and positive manner. What else? What are some other tips candidates like for example, your nephew, if he was applying, he's in dental school now, he's applying to residency. What would be some things you would tell him about this application process which is also connected to his 1 or 2 or 3 years of training as a general practice resident?
I would tell my nephew, who's up again, he's applying to college. I would tell my nephew a couple of things. The first thing is shadowing. Um, and here's the thing with shadowing. I was also on the admissions committee for NYU when I worked there. You got to have balance. First of all, I fully encourage shadowing in either a private office, or if you're getting ready to apply for residency and you're going to apply to a particular hospital, I would really try to shadow in that hospital. See if there's any opportunities to volunteer or shadow in that hospital, so that you can see, is this the place for me? Because you may say, oh yeah, it's next to my mom's house. That's fine. But if you find that you look at what the current residents are going through and you really don't like it, then the shadowing experience is important. Also, I had one, and I really thoroughly look at the application. I had one who was a black belt in Taekwondo. That's great. Again, diversity of experiences. You shouldn't be a one-trick pony. I'm happy that, that person is a black belt in Taekwondo. You put down that you put down 1,500 hours of Taekwondo, and you put what, 50 hours of shadowing in the dental. So what's the priority? So be mindful that if you're going to put down 1,500 hours, and I'm sure that you can do whichever and all kind of kicks and stuff in Taekwondo, but you have to be able to show that you're a serious applicant in dentistry, certainly for a GPR program. Can't put 1,500 for one and 50 for the other. That means that we were second, we took a lower priority. Can't do that. So be mindful of that as well.
What other tips should candidates
I told you about the letters of recommendation. I told you about the shadowing. If you can shadow in a private office, in a dental office, if you want to become a specialist, sometimes GPR is not the end all and be all. During GPR, you find out that you want to continue into endodontics, periodontics, oral surgery, pediatric dentistry. So use those opportunities before you apply for GPR. If you can show that you ortho is huge, or ortho is the most competitive in dentistry, the most. Everybody has a 4.0 in ortho. That's the golden ticket. Apparently, I'm happy being a GP, but ortho. So you got to show that you want to shadow in an ortho office. Um, so even if you're applying for ortho, a shadow in an ortho office, show that you are serious in your pursuit by shadowing in the hospital. I have one young lady who's about to take her DAT. She's applying to dental school, and she shadowed at this facility. She said, "No, you know what? I'm gonna come in. I'm gonna volunteer." I think she had to go through a whole course, and it's intense to volunteer at a hospital because it's not just, oh, here's a badge and come on in. They expect you to go to medical. They expect you to go through whatever program that the HIPAA. They expect a whole bunch of stuff from the volunteers, and then they say, please be as discreet as possible when shadowing. Try to just observe and stay and just look and not talk too much and everything else. So the volunteer and shadowing, I think that gives you a step up because as we review the applications, we will remember, oh, the Dr. Smith that you keep talking about, Dr. Hayes, Dr. Smith, she shadowed over the summer. Remember, she came here for 2 weeks in August during our August break. She didn't go away for the summer and go to the Caribbean somewhere, which is fine. I have no problem with the Caribbean. She was here at the hospital. She was shadowing. So that's valuable. That shadowing experience is valuable as well. Uh, Picking residents' brains. Ask them. They're going through it.
Yeah.
Talk to them. What do you think? And you don't have to speak in front of me. I certainly um don't need to know about private conversation, but speak to them. Is it worth it? What did you like? What don't you like?
Right.
What would you
Right.
change? So
Right.
as you're here visiting, some will visit for a day only because they can only visit for a day. Some will visit for a week. Visit us, shadow us, speak to the residents. All of those should make a difference in which programs you apply to and which programs hopefully you'll be picked for an interview.
And that's key. Some great tips. Recap. Make sure you have the right people writing your letters of recommendation. Choose them wisely. It would be helpful to
That's
have
number
them.
one.
That's got to be number one, right? Because that gives the selection committee another set of professionals to help with their evaluation of you, right? Visiting the program can't not reinforce and emphasize the importance of that. Not only is it important for residency programs where there's specialties, but also even for GPRs. You need to see, and they need to see you. You need to see the program. You need to meet the residents, which is the third thing. When you do get a chance, when you're visiting, speak to the residents, get some feedback, right? The feedback is very key, not only for the program, but for you, especially prior to applying, because the application is not free. You don't want to be spending
Ah,
extra money, $100 per program for ten programs that you're just not sure about when you possibly, if you do have the opportunity to go visit, and that may help you out of that 10 say, well, you know what, out of these 10, there's really four of them that I really, really like. Let me just apply to those, right? So another advantage of making sure that you visit the programs and programs and the leadership and the residents programs want to see that type of initiative, right? You show the initiative of being interested, not you being interesting, and there's a difference, but being interested, showing that level of interest. And one of the ways that you do that is by being able to visit the program and taking that initiative. So some real great tips and advice in addition to some of the other things that you mentioned as it relates to candidacy and what is part of the characteristics that make up an ideal candidate. Doc, what's the best way for people to contact you or contact the program if they want to visit, if they want to speak to the residents, or if they just have some additional questions? How can people contact the program? What's the best way?
The best way, I'm very happy to give out my email address, and I do answer the emails. It's F like Frank, my last name Milord, MILORD, .northwell.edu. fmilord@northwell.edu. I answer the emails because phone is just, the phone is there. I hardly answer it because I'm always running around. But the email, it's on my phone. It's wherever I go. It's in my face. I have to answer there you go. I have to answer the email. So the email is the absolute best way, fmilord@northwell.edu. I will certainly be happy to answer the emails.
And will you be able to point candidates in direction if they want to set up a site visit or visit the program, maybe through the residency coordinator? I'm not sure how that works.
Will, but... Right. That's exactly what I was going to say. I was going to say that there's a GME coordinator who is GME standing for Graduate Medical Education, who's generally responsible for people visiting the program. Awesome. And then I can connect you with her. Her name is Stacy Hill. She's so helpful. And she will be happy to arrange it. So, because we can't have too many people here. So she will arrange it so that happens for you.
And the main thing, in order to get it arranged, is to contact Dr. Milford. Contact Dr. Milford, all right? If you guys are interested or want to explore more about the program, in addition to what you've learned today, make that email so that she can get you connected and you can start the process of visiting and learning more about these programs. Doc, thanks so much for your time. It's been very helpful. You filled in a lot of gaps about residency program, but more specifically at Long Island Jewish Medical Center. So thank you very much. And you all that are listening and watching, you will say thank you to me and Dr. Milford if you go to the next episode. Go to the next episode right now. Go.
Thank you, Dr. Hayes. Thank you so much for having me. Thank you, everyone. And regardless, I wish everybody the best success that you can have. Good luck in applying and getting into the #1 residency of your choice. Thank you, Dr. Hayes.
You're welcome. Thanks.